Your Excellencies, distinguished guests, I'd like first to thank you for the opportunity to bring in the perspectives of young healthcare professionals to this very important roundtable. It was only 6 months ago when my country, Egypt, hosted the UN Climate Change Conference in Sharm el-Sheikh, and I was lucky to be appointed by the COP27 President as a young medical doctor who herself saw the detrimental impacts of climate change on her patients and generation as the first official youth envoy. 1.8 billion young people, including children and adolescents, are now shouldering the impacts of climate change on their lives and livelihoods. Almost 1/3 of deaths of children under the age of 5 is directly linked to environmental degradation. 1 out of 5 children lack access to safe drinking water, while air pollution affects young people the hardest. This is also combined with the exacerbation of the inequalities in access to healthcare services, education, and decent job opportunities, especially for young women and girls who make up 90% of the climate migrant population, and also experience gender-based discrimination and violence that is aggravated by the scarcity of resources. Climate change is also affecting the mental health of young people, from despair at the unpredictable climate disasters to the anxiety about the future of mankind. These feelings are further heightened by the disconnect between young people and their governments and public institutions. Yet, I'm not here to tell the story of my generation's distress, distrust, and disappointment. I'm here to share that young people around the world are leading the climate challenge. They are doing this with innovation, with dedication, and most importantly, with a powerful health argument that climate action is going to provide the conditions for a world where no one has to ever face any health challenges. Creating resilient societies with cleaner air, access to green spaces, safer sources of energy, as well as a well-connected community. I'm proud to be part of the beautiful health community of young healthcare professionals who believe in their responsibility as the first-line responders to the impacts of climate change on health. Medical students are working with their institutions to integrate climate change in curriculum. Young health practitioners are prescribing nature to improve their patients' well-being when connecting with nature, as well as decarbonizing their healthcare facilities. However, such youth-led bottom-up approaches remain siloed from the top-down negotiation processes because of the little dialogue between the ministers that are in the negotiating rooms and young people who are on the outside. And that is why, as the COP27 presidency in Egypt, we took progressive steps to really transform the integration of young people, as well as centering and ensuring that health and intergenerational equity is far from optional in public and political processes. And this was exemplified by the recognition of the right to a safe, clean, and healthy environment in the COP outcome decision, as well as creating the first of its kind dedicated pavilion for children and youth, and organizing a youth-led climate forum with ministers, negotiators, and chairs of country groups. These instrumental breakthroughs marked a critical turning point for the meaningful engagement of young people in the highest level of political decision-making. Similarly, the WHO Youth Council was exceptionally established to reflect the voices of young healthcare professionals who made climate change one of its main working group priorities, as well as the Yongo Health Working Group, who mobilized thousands of young healthcare professionals in the NFCCC processes. As we explore today the ways to strengthen the role of the health community, I would like to make 2 specific asks. First, decisions around climate change and health remain siloed, and yet young healthcare professionals have the capacity, the vision, and the capabilities of bringing in a joint vision between climate change and health, translating what we know with what we can do. And that is why my call is at the ministries of health who are present here today to think about the reorientation of their institutionalized structures, to include young healthcare professionals, not as add-ons, but as natural stakeholders, as key partners that can accelerate action on initiatives such as the Attach, as well as integrated the voices of the most impacted communities at the center. Young people are a diverse constituency with uniquely critical perspectives that should not be marginalized. My second call to action is as we now take stock of the implementation of the Paris Agreement for the very first time in history at COP28 under UAE's leadership, it is important that health and intergenerational equity is reflected in the outcome. We also have the first ever Health Day, and we want to see the outcomes of the Health Day reflected in the COP outcome decision. And this recognition will play an integral role in ensuring the inclusivity, transparency, and the accountability that young people want to see from their governments so that they are delivering for and with young people. And this entails consulting youth-led organizations and groups in the lead up to COP, as well as understanding their emerging needs, the deep interconnections between climate change and the health of the young people, which can be supported by WHO, the COP28 presidency, as well as the Youth Climate Champion, Her Excellency Shayma Al-Mazroui. Finally, this event is a testament to our collective will to voice a clear message that the climate crisis is a health crisis. As a young medical doctor myself, I'm here to evoke a feeling of urgency, to address the climate and health emergency and the systemic inequalities my generation is desperately living through. We know that we are entitled to a better future. The science is clear, the solutions are there. So let's work together across silos, across generations, to build the healthy and secure world that young people want and deserve. Thank you.
Thank you so much, Omnia.